When someone comes in for a breast augmentation consult, they often ask, what are the risks? What are the complications? Well, first of all, close to about 300,000 cosmetic breast augmentations are performed each year in the United States alone. There are risks and complications with everything we do. For breast augmentation, the risks and the complications, if they're going to occur, are very rare, they're uncommon, and they're usually minor cosmetic issues. First of all, common things that we see would be temporary sensation changes. Either numbness or sensitivity can affect the breast skin or the nipple, but these are typically short-lived issues that improve over time. The other thing that a woman could run into is some minor asymmetries. But first of all, people need to realize that breasts aren't perfectly symmetric and that breasts are naturally asymmetric and they're still beautiful. Rarely, a woman could have an implant malposition. Now, typically, implant position can be easily controlled using bras, using straps, and manipulated to the point where surgery would be rarely indicated. Capsular contracture is a risk associated with any foreign body that we place into the human body, and it's a normal response to a foreign body. What a capsular contracture means is that a patient's body, for whatever reason, forms a thicker scar around their implant. The lifetime risk of capsular contracture can be anywhere from 5 to 20%, depending on the situation. Mild contractures are typically handled non-operatively, as mild breast firmness is fairly well tolerated by most women. If a contracture becomes more severe, it can cause increased firmness and even change the contour of the breast. And in those situations, surgery could be indicated to release the scar or remove the capsule and place a new implant. Appearance changes do occur, and so there's always the chance of sagging issues or sometimes even thinning of the skin around the implant. First of all, it's normal to feel the device because that's what it is. It's not a breast. So women will feel the device and perceive it under their tissues. Larger implants can be higher risk for complications just because there can be more tissue stretch, more surrounding tissue thinning, more risk for sagging over time, and more risk for what we call rippling. Rippling means that the implant edges can be seen through the skin, and this means that things are thin. So if a woman is very thin, or if she goes with a large implant, tissue thinning can occur and implant edges can be perceived in certain body positions. Less common risks have to do with surgery in general. There's always risks of bleeding or hematomas, risks of infection, risks of anesthesia, risks of allergic reactions, and things like that. Typical risks with life and things that we do. But statistically, if you look at the risks associated with breast augmentation and you compare them to, say, the risks associated with driving on the freeway, the risks of breast augmentation are very, very low and surgery is very, very safe. My name is Dr. Hayley Brown, and I've had 15 years of experience performing breast augmentation. The office phone number is 702-260-7707. Please also visit my website at www.deserthillsplasticsurgery.com so that you can not only learn about breast augmentation and the implants that we use on a regular basis, but also look at my extensive photo gallery where you can see hundreds of before and after pictures